The one good thing that we've learned out of China and Singapore and South Korea and Taiwan is that we can flatten the curve if people follow the rules of isolation, of keeping the 6 feet or 1.5 metre distance from each other, avoiding large crowds. We can control sort of the mass hit to hospitals. We've seen a bad case in Italy where there aren't those controls at the start and it can get out of hand. But if we follow those rules, we will have enough ventilators between ourselves and our competitors to take care of the wave in Western Europe, United States, and in Australia as well. So we've definitely worked with the governments, in China to provide the products there over January and February. We've been working throughout Southeast Asia in mid-February to March. And now as it's spreading, we have worked with the Australian government to provide a number of ventilators to their national stockpile, but also with the states and local cities there as well. And as we get to, the more populous countries in the Western world, France, Germany, UK, and the US, we're doing the same thing with the NHS. We're working with an RFP for them. And I was on the phone earlier today with the Secretary Azar from HHS here in the United States. And the FDA Commissioner Hahn also has changed some rules to allow us to bring products that are CE marked and made in China, but CE marked only for Europe, but be able to bring them into the United States. So we're seeing a really good, I'd call it private-public partnership to provide the ventilators to those in need.
Yeah, Mick, this is Martin. Let me quickly jump in. And I think the point you're trying to make, and I think it's important that viewers especially understand this, is on the public part, that they must do their part. I mean, you're saying you're ramping production 2x, 3x, even higher or faster, Shanghai, Singapore, also Australia, and you together with other ventilator makers, will be able to meet demand for these crucial machines, but only if the public does its part and does this social distancing thing properly. Otherwise, it's a race where you're going to be always behind.
Exactly, Martin, and you make a really good point, and I hope everyone listening, obviously thinking about the financials and the market on CNBC here, but look, the bottom line is we're all individuals, and if we do it right, we can see the models that worked. Singapore flattened the curve. They're getting a little bump up from some of their people who are visiting Europe, but they're going to be able to manage that again. South Korea flattened the curve. Can we, in the United States, in Australia, in France and Germany, UK, in these countries with all our freedoms, can we say, you know what, I've got my freedom, but I choose to stay at home for the elderly and for those with compromised immune systems, post-chemo or radio, that if they get this, there's a double-digit percentage of death. For me, I'm young, healthy, okay, I've got a very small chance, I'm okay, but you know what, I'm going to follow all the rules. And so that's a really good point, Martin. And if everybody does that, we follow the South Korea model, follow the Singapore model, we will be fine. If we don't, and we go that sort of early stage, Italy's put the controls in now, we go that early stage Northern Italy model, the hospitals there did not keep up in the early phase here, and we're struggling. We still haven't caught up in Italy. We're doing better in Germany and France just next door, and so I do think if people listening are thinking about the future, if we get through this in 3 to 6 months, as Bernanke saying, yes, that'll happen if we all do our part. If we don't, it could be longer. So let's do our part. And then on the manufacturing side, yeah, we're 2x and 3x on the vents. We are going to increase by 10x on the ventilation masks. And we are not going to run out of masks for our ventilators. But, yeah, we've all got to do our job, public, private, and individual citizens.
Hi, Mick. It's Dan here in Singapore. Thank you for the work that you're doing in this space. I wanted to get a sense from you about where you think the virus is going to move next. You're sitting there in the United States, which does really seem to be at least 6 weeks behind the rest of the world. And while we watch the death toll continuing to rise in places like Italy and Spain, China appears to be coming back to life and getting back to business. What are your experts telling you about where this virus is going to move next and where the epicenter is going to be in the coming weeks?
Yeah, it's a really good question, Dan. And we our Chief Medical Officer, Carlos Nunez, is working very closely with academics at University of California, San Diego, but also at Johns Hopkins University to model country by country, city by city. Look, we haven't seen a flattening yet of the curve in Italy, but it's starting to sort of slow down a little bit on the rise. So there's some good news there. There's actually reasonably good news of the very low mortality rate we're seeing so far in Germany, France, but we're worried that maybe our denominator's not enough. We don't have enough tests out there. And here in the United States, it's just so early in the game that hopefully we can learn from the good models that worked in Asia, some models that are working in Europe, some that didn't work in Europe, and you've now got both ends of that spectrum. But look, the models definitely say that the United States is the next wave to hit. We're seeing federal governments put together through FEMA, emergency response to coordinate this from a federal level, and we have a very strong, I would call it, public-private partnerships here, where ResMed is working with local hospitals, private hospitals, but also governments and states and regions and the feds to make sure that we coordinate the response and get the ventilators and the ventilation masks to those who need it. And I don't want to be myopic just about our industry. There's also protective equipment, there's ICU beds, there's ward beds, and there's hospital space. And then the really rate-limiting factor in this whole thing, Dan, may be those frontline heroes, I'll call them, the people who are respiratory therapists, respiratory nurses, and pulmonary and critical care docs putting on this protective gear and setting up these ventilators, because they don't set themselves up. You need someone to align the mask, intubate the patient or fit a mask and get the ventilator setting so that you keep that person breathing while they fight the disease.